Trinidad and Tobago is commemorating 60 years of independence, and what a milestone it is indeed. While there's every reason to celebrate, worldwide there continues to be an epidemic of non-communicable diseases, and unfortunately, Trinidad and Tobago is not exempt from health challenges such as these. Chief Medical Officer Dr. Roshan Parasram said over the past decade this has been a persistent concern, and he believes citizens need to do more toward maintaining a healthy lifestyle.
Worldwide, there continues to be an epidemic of non-communicable diseases, and unfortunately, Trinidad and Tobago is not exempt from health challenges such as these. Chief Medical Officer Dr. Roshan Parasram said over the past decade, this has been a persistent concern and feels we have been personally lacking when it comes to maintaining a healthy lifestyle. He attributed the development to poor habits of the population.
We have been consuming more food, for example, less exercise, our jobs have changed, there's less outdoor time, and it has redounded to negative impact in terms of the way our health has been placed along the trajectory of our life.
Dr. Parasram said the epidemic of NCDs has played a huge part in the way this country has had to structure its health system.
Initially, the system would have been a health-based model, meaning that you have an illness, you come in, you get treated, you go back out. The prevention is becoming the cornerstone of a healthy population, wellness to follow, and that is where the health systems of the future are going to be based. So it will be coming away from a hospital model, going towards building out that primary care system even more than we have in Trinidad and Tobago, and of course going towards a wellness model where you have integration of exercise, community, and wellness.
The past 2.5 years of the COVID-19 pandemic have also shone the spotlight on new challenges for this country's health sector.
Being able to deal with the misinformation and disinformation from a health system's perspective is difficult.
Dr. Parasram says while there remain concerns about the population's overall health, there has been some significant progress in the field of healthcare and medicine as well. He said of all the CARICOM nations, this country has one of the most robust systems in terms of specialty care delivery at the disease level.
We can do complex neurosurgical cases, we can do complex urologic cases, we have hematologists in the country that are well trained in terms of international standards. We have pediatric oncologists that are the best in the world.
Perhaps too many to mention, Dr. Parasram shared a few of this country's medical giants that came to mind.
Professor Vijay Narayan Singh in the field of vascular surgery has been exceptional. For urology, for example, we have Dr. Lal Sao has provided service. There are people like Professor Courtney Bartholomew for HIV and AIDS. And then the list goes on and on and on.
On this our 60th year as an independent country, Dr. Parasram shared his wish for the nation.
We have to keep an eye on our watchwords, discipline, production, and tolerance. I think we have lost a little bit of that along the way. If we keep those principles in mind and we head towards it, I think we could be a better society. By way of health, as I said, the health of the nation is the wealth of the nation.
Crystal Wilson, TTT News.
This feature was powered by the National Gas Company of Trinidad and Tobago, at the forefront of energy